The Home Health Quality Improvement National Campaign welcomes you to Smoking and Your Heart. This video is part of a series talking about different ways you can work with your healthcare team to reduce your risk for having a heart attack or stroke. In this video, we'll talk about the effects of smoking tobacco on the heart and blood vessels. When we talk about smoking, we're generally referring to smoking cigarettes, cigars, and pipes. However, chewing tobacco has many of the same harmful effects due to the nicotine and other harmful chemicals. Certain specialty cigarettes, like the Kretek from Indonesia, have 2 times the tar and nicotine of standard cigarettes. Electronic cigarettes are new, and there's not enough research on these devices yet. These battery-operated devices deliver nicotine in a vapor. Nicotine from any source has harmful effects on the heart. In this video, we will be talking about the effects of smoking in general. Also, secondhand smoke affects people that are around active smokers. Even though the non-smoker is not inhaling the same amount of the smoke that is being inhaled still has bad effects on the non-smoker's heart and other organs. So what are some of the effects of smoking on your heart? There are many different effects from the ingredients in the tobacco as well as the smoke itself. Nicotine and some of the other chemicals in the tobacco can cause damage to your heart and blood vessels as well as nerve endings. When you smoke, oxygen going to the heart is reduced. When a cigarette is lit up and burning, there is carbon monoxide released. So when you inhale the smoke, the lung pulls in this carbon monoxide. Since the lung has only so much space, there is now less room for the good oxygen. With less oxygen in the lungs, there's less to go into the red blood cells and be carried to all of the body's cells, including the heart muscle cells. The nicotine in tobacco causes your body's nervous system to react and increase blood pressure and heart rate. This effect happens right away and causes more stress on the blood vessels and the body's organs. This makes your heart work harder. Other chemicals in tobacco cause inflammation in the arteries and veins. This is the body's way of trying to protect itself from harmful chemicals. The inflammation causes the body to increase platelets in the blood. This leads to thickening of the blood, which can cause a clot to form. The clot can break loose, travel through the blood vessels, and cause a heart attack or a stroke. Smoking can also increase bad cholesterol levels and lower the good cholesterol levels in your blood. This will cause thickening and narrowing of the blood vessels, which affects how much blood and oxygen can get to your cells and makes your heart work harder. So what happens after you stop smoking or stop being around a smoker? It actually doesn't take long to see the benefits of quitting smoking. Less than 30 minutes after you quit smoking, a person's blood pressure and pulse go back to normal. Within 8 hours, the carbon monoxide goes back to normal, which means that there is now more oxygen getting to all the cells in your body. The chances of a heart attack decreases in just 24 hours. Make sure you heard that fact clearly. After the first day of quitting smoking, your risk of having a heart attack decreases. The nicotine in tobacco causes damage to nerve endings. In 48 hours, those damaged nerve endings begin to regrow, which improves your sense of smell and taste. In 72 hours, breathing gets easier and the lungs expand more fully. This allows for more oxygen to be absorbed into the blood and heart. Between 2 and 12 weeks, lung function increases 30% and circulation improves. The 1-year mark finds the risk for coronary heart disease decreased by half of that of a smoker. The next 2 facts are amazing. After quitting for 3 years, heart attack risk is similar to if you had never smoked. After just 3 years of being smoke-free, your risk of having a heart attack is like that of someone who's never smoked. Somewhere between 5 and 15 years, your stroke risk becomes almost the same as if you had never smoked. Did you find these facts surprising? What about encouraging? Now that you know these facts, maybe you will consider quitting. Remember, in just a few days after you quit, your body is healing in many ways from the negative effects of tobacco smoke. Please talk to your nurse and doctor about quitting smoking. There are a lot of ways that you can get help to quit. Quitting smoking is hard. And it's even harder when you try to do it alone. Get help. To learn more about smoking's effects and how to quit smoking, talk with your healthcare team and ask to watch other videos in this series when you're ready to think about quitting. Thank you for watching Smoking and Your Heart. We hope that you've learned more about how smoking affects your heart and blood vessels.